Understanding what your stool says about your health can provide important clues about your digestive system and overall well-being. Here are 10 alarming things to watch for. Blood and stool. Possible causes: hemorrhoids, anal fissures, diverticular disease, inflammatory bowel disease, IBD, colorectal cancer. Action: seek medical attention immediately, especially if the blood is bright red or accompanied by pain. Black or tarry stool. Possible causes: bleeding in the upper gastrointestinal tract, such as from a stomach ulcer, esophageal varices, or a tear in the esophagus. Action: consult a doctor promptly to determine the cause of bleeding. Pale, white, or clay-colored stool. Possible causes: bile duct obstruction, liver disease, pancreatitis, or the use of certain medications. Action: see a healthcare provider to evaluate liver and gallbladder function. Greasy or oily stool. Possible causes: malabsorption disorders like celiac disease, chronic pancreatitis, or cystic fibrosis. Action: schedule a medical appointment to assess for malabsorption issues and nutritional deficiencies. Floating stool. Possible causes: excess gas, malabsorption, or a high-fat diet. Action: if persistent, consult a doctor to rule out underlying conditions like celiac disease or chronic pancreatitis. Yellow stool. Possible causes: Giardia infection, celiac disease, or a diet high in fat. Action: if accompanied by foul smell and diarrhea, seek medical advice to test for infections or digestive disorders. Mucus in stool. Possible causes: inflammatory bowel disease, IBD, irritable bowel syndrome, IBS, or an infection. Action: visit a healthcare provider to investigate potential inflammatory or infectious causes. Thin or narrow stool. Possible causes: colon cancer, rectal cancer, or a narrowing of the colon. Action: contact a doctor for a thorough examination and possible colonoscopy. Unusually foul-smelling stool. Possible causes: malabsorption, infections, celiac disease, Crohn's disease, or chronic pancreatitis. Action: if persistent and accompanied by other symptoms, seek medical evaluation. Chronic diarrhea. Possible causes: infections, IBD, IBS, lactose intolerance, or certain medications. Action: consult a healthcare provider if diarrhea persists for more than a few days to identify and treat the underlying cause. If you notice any of these symptoms, it's important to seek medical advice to ensure proper diagnosis and treatment. Your stool can be a valuable indicator of your health, and paying attention to changes can help catch potential issues early.